Hepatitis Day serves as a vital global initiative observed annually to raise awareness about viral hepatitis and its impact on millions worldwide. Commemorated on this day, diverse events, campaigns, and educational programs aim to promote prevention, early detection, and treatment options. By fostering public understanding and support, Hepatitis Day strives to reduce the burden of hepatitis, ensuring a healthier future for affected individuals and communities. Meet Dr. Pathik Parekh, a distinguished hepatologist and liver transplant physician renowned for his exceptional expertise in treating liver disorders and conducting life-saving liver transplant program. With a profound commitment to patient care and cutting-edge research, Dr. Pathik Parekh has significantly contributed to the advancement of hepatology, earning him immense respect in the medical community. Welcome, sir. Sir, I want to ask, what is hepatitis?
So hepatitis means any swelling of the liver. So under normal circumstances, liver is functioning, having more than 500 functions, and whenever there is some reason of swelling of the liver, it presents as hepatitis. So hepatitis is not similar to jaundice. Jaundice is actually a symptom, while hepatitis is a disease.
Now, sir, I would like to know what are the types of viral hepatitis?
So when we talk about viral hepatitis, the viral hepatitis normally we divide according to the hepatitis caused by hepatotropic virus or non-hepatotropic virus. So to make it simple for the audience, hepatotropic virus are the ones which we normally encounter. So like hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E are the ones we normally encounter, and they are known as the hepatotropic virus. They are primarily affecting the liver. But then there are non-hepatotropic virus which affect liver as a part of the whole body, and they are CMV, VZV, EBV or HSV. They are non-hepatotropic virus. So these are the general causes of viral hepatitis.
Sir, now please tell me what are the 3 stages of hepatitis?
So whenever somebody gets affected by viral hepatitis, and mainly it is hepatitis A and hepatitis E. So in those stages of hepatitis, how does it manifest is after around a period of 15 to 45 days, there is onset of symptoms, and these symptoms are usually the prodrome symptoms. So that is the first stage, is a prodromal stage, during which you will have fever, malaise, body ache, nausea, vomiting, loss of appetite. Once that stage ends, there is a symptomatic stage. That symptomatic stage is the stage of jaundice. That is when people start manifesting yellowness of eyes, yellowness of urine, and at that time the fever goes down. And after that, there is a stage of resolution, during which even the jaundice starts subsiding and then all the symptoms disappear. So these are the 3 stages of acute viral hepatitis.
So how is hepatitis spread?
So when we talk about viral hepatitis, so as I said that when we talk about viral hepatitis, it is mainly hepatotropic viruses, that is hepatitis A, B, C, D and E. Now D is less common in India. For Indians, we concentrate on A, B, C and E. Now hepatitis A and E, which are food and waterborne. So because of poor sanitation, they get into your food and water, or even most commonly that we see is ice cubes, and then they enter your body. Unlike this viruses, hepatitis B and C spreads via body fluids. So they can spread sexually as well as by blood, as well as by different body fluids.
Who is most at risk for hepatitis?
So when we say the risk factors for hepatitis, for viral hepatitis A and E, it is the poor sanitation. So those who are living in an unhygienic condition are likely to catch this. But when we talk about the risk factors, more important is hepatitis B and C, because they would enter your body without causing any symptoms and you would not even know. So the way it spreads and the risk factors are those who get tattooing, those who get shaving outside in an unhygienic blade, even sometimes unhygienic injection practices, unhygienic sexual practices, or those who inject drug themselves, or sometimes is a professional hazard like us doctors who can get the viruses once they get pricked or needle stick injury.
So, can hepatitis get transmitted from mother to child?
Yes, this is very important. So, hepatitis B and C can get transmitted from mother to child, and it is recommended that all women who get pregnant should test themselves for hepatitis B and C. So, if they suffer from hepatitis B or C, they need to see the hepatologist and they need to talk whether they need treatment during the pregnancy or they need any specific medications to prevent the transmission of virus during the delivery or even a cesarean section to the child. So, it can transmit from mother to child.
So, what are the tests for hepatitis?
So when we talk about tests for hepatitis, there are two kinds of tests. The first test are to detect the hepatitis and second test are to detect the cause of hepatitis. So to detect hepatitis, it is known as a liver function test, where we get tests like bilirubin, SGPT, SGOT, alkaline phosphatase, GGT, prothrombin time and albumin. Besides that, we also need sometimes complete hemogram and a renal function test. Also, for the etiology or the cause for this hepatitis, we test for certain viruses like hepatitis B, hepatitis C, hepatitis A and hepatitis E. So there are antibody tests to detect for these viruses as well, which are easily available in the market.
So, one of the most common questions which we get asked is hepatitis cancerous?
So yes, it is. So if we talk about liver cancer, hepatitis B is the most common cause of liver cancer in India, and hepatitis C is the most common cause of liver cancer in the West. So hepatitis B and C, which can enter into your body without you being knowing it, and it would stay in your body for a prolonged period, probably a decade or more, and then it may directly present as a liver cancer, even sometimes without damaging the liver or without causing cirrhosis.
So, what is stage 4 of hepatitis?
So stage 4 of hepatitis is the hepatitis for chronic stage. So whenever a virus enters into the body and it stays for a prolonged period, it damages the liver. And when somebody says it is a stage 4 of hepatitis, it means that the liver is damaged to such an extent that we label that liver as cirrhosis of liver, which is equivalent to a damage of around 70% of your liver functions.
So, is hepatitis curable?
So hepatitis is curable and preventable. So hepatitis A and E, it usually requires symptomatic treatment. You don't require any specific treatment for those viruses. Hepatitis A vaccination is available, so you can prevent hepatitis A by getting vaccinated. Hepatitis E vaccine is likely to be available in future. It is under research. Probably in a couple of years we will get the vaccine. Coming to the dangerous one, that is the hepatitis B and the hepatitis C, there are very good medicines available for the treatment of these viruses. Hepatitis C, which was believed to be poorly curable initially, now is a better curable, and there is a success rate of more than 99% in curing these viruses.
So now I have this one last question for you. What is that one message you would like to give to the people watching you now?
So my message is very clear that hepatitis is preventable. So as I mentioned earlier, that hepatitis A and hepatitis B vaccines are available, and everybody should be getting this vaccine as early as possible. For those who are born after 2002, they are vaccinated for hepatitis B. Those who are born before that needs to go out, test themselves and get vaccinated. Otherwise, good sanitation habits and avoiding unhygienic injection practicing or unhygienic sexual practices, avoiding unhygienic tattooing practices is essential to prevent transmission of hepatitis B and hepatitis C, and thereby decrease the incidence of liver cancer worldwide. Thank you.
Thank you, sir, for your time. And Dr. Pathik Parekh is available at Apollo Hospitals, Ahmedabad, 24/7. To book an appointment, you can call on 840-180-1066, and for emergency, you can dial 1066. However, if you want to book a consultation of Dr. Pathik Parekh, you can download Apollo 24/7 and get your appointment there. Namaste.